Hello everybody. So today we are going to talk about necrotizing enterocolitis, a condition which is found in preterm neonates, and the name itself suggests what the problem is. That is, there is necrosis of the intestinal tissue, enterocolitis, that is for the small and large intestine, that is inflamed. So now, how is it that we will diagnose this condition? What are the problems in the premature infant and how it's treated is what we're going to discuss in this video. So now the clinical symptoms which are present in a preterm neonate with necrotizing enterocolitis are mostly, since it's a GI condition, the symptoms are mostly involving the GI tract, kind of a presentation, an acute abdomen sort of a presentation where you have emesis, the child vomits, there is poor feed, there is if you try to aspirate through the infant feeding tube, there is bilious gastric aspirate, and there is distension, abdominal distension. As we go down, there is vomiting, distension, that is the intestine is lazy, there is ileus as well as bloody stool. So when we talk about symptoms, there is vomiting, and then when you attend to the infant, you put a infant feeding tube, there is bilious gastric aspirate, and on auscultation there is intestinal ileus. Now at times, along with this picture, you can also have associated dehydration, because as I already said, the child is not taking feeds, so it's very likely that the child can be dehydrated, and dehydration again is not good for the child with this problem. It will lead to worsening of the situation. Primarily it is seen in low birth weight and preterm neonates, but occasionally it can also be present in mature neonates, like if there is sepsis, some sort of infection, then in those cases there can be necrotizing enterocolitis even in term neonates. Now this was the clinical picture of the child, a sick child vomiting with distension, not taking feeds and bloody stools. Now what is it that helps us investigate the condition is the blood and radiological findings. Now when you do a blood sampling for the child, thrombocytopenia is most of the times associated with necrotizing enterocolitis. So low platelet count or thrombocytopenia is mostly associated with necrotizing enterocolitis. If you do a straight X-ray abdomen, radiological investigation will show a lot of things, because as we know, there is some sort of inflammation of the gut, so that can depict in various ways on a radiological imaging. If you consider this to be though it's not a very good picture, if you consider this to be the abdomen of the preterm neonate with these as the two domes of the diaphragm, the liver and the intestine, then what I want to talk about is there is pneumoperitoneum. Pneumoperitoneum can be present in children with necrotizing enterocolitis, the neonate with necrotizing enterocolitis. Apart from pneumoperitoneum, can also be as a result of intestinal perforation, which can lead to pneumoperitoneum, and if there is a perforation, then definitely there has to be prompt action and resection of that portion of the gut. Prompt treatment, prompt surgery is extremely required. Apart from that, gases can be there in the biliary tree. There is invasion of the bacteria into the bowel wall. So due to this invasion, there can be gases which are seen in the bowel wall. This condition is known as pneumatosis intestinalis, a very characteristic picture of this disease. And since you can understand the bacteria invading leads to gaseous accumulation in the lumen, in the wall of the intestine. Apart from that, there can also be gaseous accumulation in the biliary tree, that is hepatobiliary gases, and at times it can also be there in the portal vein. So a lot of gases, a lot of perforation, air, like gases, air and perforation at times. With this clinical picture, it definitely gives you a hint that the child is having necrotizing enterocolitis. Now, if we talk about why is it that this happens, from the name itself we can very well make out that it's a necrosis. So a condition where there has been perinatal hypotension or perinatal hypoxia leading to gut hypoxia, ischemia and necrosis. Hypotension and hypoxic conditions can lead to necrotizing enterocolitis. Apart from that, if there is anemia associated in a child, preterm born child, that can definitely increase the risk of the child having necrotizing enterocolitis, because anemia means again there is hypoxia, chances of hypoxia increases. So apart from that, sepsis almost everywhere, wherever there's infection, inflammation, sepsis always is there as a cause of the condition. So sepsis definitely as it is the preterm child is so very immature. So if it has sepsis, again that sepsis can lead to necrotizing enterocolitis. Umbilical catheterization, that also leads to hypoxia and again can cause necrotizing enterocolitis. Exchange transfusion, and a very important point I would want to mention along with the causes is the feed of the child. Now, when the mother is not very well versed with how to treat the infant, or she doesn't have too much of an information, or she's not been told properly, or whatever the condition is, and for some reason the child has been given hypertonic solution as feed, then definitely that will draw water and will dehydrate the child. Cow's milk, again compared to mother's milk, has low water content, higher protein content, and more of casein compared to whey protein. Now, casein is a protein which is a little difficult to digest by this immature intestine of a preterm child, and on the other hand, whey protein, which is the predominant protein in the human, as the mother's milk, is a better protein. But if you give the child cow's milk, then definitely it is a higher burden on the intestine of this immature preterm child. Okay, apart from that, cow's milk, it is prone to getting infected. So it can transmit infection into the child, into the gut of the child, and that can again lead to necrotizing enterocolitis, underlying infection, which can lead to this condition. So cow's milk, hypertonic solutions, and that leading to dehydration. Now, why is it that dehydration is so important? Because dehydration will cause increase in the viscosity of blood, which will decrease the perfusion of the mesenteric area. So mesenteric perfusion will decrease, and that will again cause hypoxia to the intestine and lead to necrotizing enterocolitis. So this in nutshell is the hypothesized cause, because not a very clear idea has been obtained about the exact causes of necrotizing enterocolitis, but these are the causes that have been hypothesized in the causative agents causing necrotizing enterocolitis. Now, apart from this, if we talk about the pathophysiology, that is again not very clear. It is still being hypothesized. So there are a lot of things that are associated with the pathophysiology. Firstly and foremostly, when I say a lot of things, means it's multifactorial. So it has multifactorial pathophysiology. There is genetic predisposition that can lead to it. Then there is intestinal immaturity, because we know preterm is immature. So immaturity of the intestine is again a predisposing factor to necrotizing enterocolitis. Many a times this intestine is immunoreactive to whatever is being given as feed. So increased highly immunoreactive mucosa can again lead to an inflammation and necrotizing enterocolitis. Infective causes I have already discussed, could be from the cow's milk or any cause of sepsis that can lead to abnormal microbial colonization in the intestine. Apart from this, the blood vessels which are there, they're all very, I would say, they are very immature preterm child. You can understand the microvasculature of the gut. At times even the tone, there is an imbalance in the tone of the microvasculature of the gut. Again, that can lead to necrotizing enterocolitis. And enteral feeds exposure, I've already discussed, cow's milk or hypertonic solution feed can lead to can act as a predisposing factor to necrotizing enterocolitis. Now, getting into the treatment part of it, there is a medical alternative. Medical alternative, we can understand it's an acute condition, so gut rest is the something which is of prime importance. You have to decompress the stomach. That is an infant feeding tube. Aspiration has to be done. Infant feeding tube has to be inserted. Bowel has to be rested. Now bowel rest means there is no oral feed, only parenteral feeding. So parenteral feeding, parenteral nutrition and abdominal decompression. Apart from that, you can see it's an infective inflammatory condition. So broad spectrum antibiotic to save the child is very important. Okay. Now suppose if the child is deteriorating clinically, biochemically, then surgical intervention has to be considered. Apart from this indication, if there is a perforation, some acute condition, then definitely a surgical line of management, even in a premature small infant, has to be considered. Now it's really sad, but that's the surgical part of it, that if the baby doesn't settle or if there's a perforation, you have to operate the child. Now what are the procedures that can be done? If there's a perforation, first you do an exploratory laparotomy. Either if there's a perforation, then resection might be needed. If there is a large amount of segment which is involved, then at times a stoma might be needed, or if there is a possibility of just draining out the collection inside, then that can also be done. So an exploratory laparotomy followed by SOS treatment depending upon the findings which are there intra-abdominally is the surgical treatment which is to be done in children with necrotizing enterocolitis.